and welcome back to Dream Girl. I'm Sheen, your host, and today we're joined by the wonderful Dr. Hasia. Hi.
Hi, Sheen. Thank you so much for having me.
How are you?
I'm good, thank you.
It's been a long time since we last met, isn't it? I feel like you had just moved to Dubai when I met you last
I
time.
did, actually. I think it was like almost a year ago.
Right?
And I had just moved to Dubai.
So how has the year been?
It's been crazy. It's been a roller coaster. I think crazy
In a good
is
way?
good, bad, ugly. Honestly, it's been everything. It's crazy.
But you're staying, yeah? You're not leaving Dubai.
So far, staying it hasn't scared me off just yet, but
Okay.
let's see.
But what did you think was the biggest challenge for you?
The biggest challenge, really navigating people here and finding the right group of people to be with, and also avoiding scams. Can I say that?
Yeah, you can.
Avoiding scams.
I know. I feel like it's really hard. I don't know if even scam, but who to trust, right?
This is the thing.
Yeah.
Because they might not even scam you, okay? But just trusting people. And I'm a Scorpio. So I'm naturally like the most distrusting person you're ever going
This
to
made
come
it all
across.
worse for you.
Yeah.
But I'm the opposite. I'm Gemini, so I trust you easily.
Oh gosh, yeah.
So I've had my fair share. But it's so interesting that you've touched on making friends, because everyone who asks me about moving, that's the first thing they ask you, right? How easy is it to make friends in Dubai? And earlier on, I would say, oh my God, it's so easy. Everyone wants to make friends. And then slowly I started to realize, well, not everyone is a friend I want to have.
Exactly. Because it's a very social city. Everyone does definitely want to make friends, but can't trust all these people. I have a very close circle. Like I don't even want to say the numbers. I don't want to offend any of my friends.
They're going to be there thinking, am I in there?
But literally,
Yeah.
very like
Small circle.
very small.
But that's good though, because it's better that way. And you know what they say, right? You're also the average of the people around you. So you don't want to be surrounded by people that you don't want to be like. So
Absolutely.
yeah, that's really good. Okay, so tell us, what do you do professionally?
So I'm a skin and aesthetics doctor, and I moved over here just over a year ago to open a clinic, start work out here, launch my skincare brand here because I have a skincare brand in England. I've had that for now just over 3 years. So I thought, okay, let me test the waters in the UAE because after COVID, the UK was not the same. After COVID, people lost jobs. And the opportunities weren't there, businesses failed, and people just don't have the same spending power that they used to have in the UK. Economy is really terrible. So if you have a business, you need to be in a place where economy is thriving, because then of course your business has higher chances of thriving. So really that's what made me move to Dubai, to the UAE.
Yes, so now that we know you're the skin expert, and I've seen your little reels pop up as well on Instagram, and it's crazy. I get so sucked into it as well, when people start talking about different things. I'm sure there are myths, there are everything. But before we get to that, as you said, Dubai is a little bit different, and I feel like my skin has never been worse here because of the pollution. Is that true?
Absolutely. You come to Dubai and the first thing that happens is your skin is ruined, your hair is ruined. You'll have like acne like never before, dry skin. You'll suddenly lose your hair, and you're sweeping it up every day because you're losing big clumps. And the main reason is the water. It's very harsh here. And the second thing is we're living in a desert climate. So you can put all the concrete buildings in the desert. We're still in a desert climate. These are the biggest factors.
So how do we combat that?
So have a good dermatologist.
Hey.
I mean, this is why the skin and aesthetics industry does so well in Dubai, because when you live in a desert, your skin is ruined, your hair is ruined. So, number one, see someone who knows what they're doing, talking about, use the correct skincare ingredients if you have problematic skin, things like retinoids. Have a bespoke cream made for yourself, because we know skincare is not a one size fits all. I do bespoke skincare, so we're going to make a cream especially for you to target your skin concerns. And creams like this, they work overnight, 2 days, 3 days. They're very quick, fast acting. With the hair, people say get a filter. Filters don't really work.
I got one.
Does it work?
I saw a difference. You know how I noticed it?
Mm-hmm.
Not through the hair, but whenever I come out of the shower, my the skin on my feet gets really dry. So I need to
Okay.
moisturize immediately.
Mm-hmm.
Since I put the filter, I stopped having that sensation.
Okay.
Yeah.
So I found the same thing. My skin improved. So I don't have dry skin, chicken skin. With the filter, it improved.
What's chicken skin?
Chicken skin's when you get the little tiny dots on the skin, and they're like red kind of dots. So your skin doesn't look like clear,
It's not smooth.
So I had that, and with the filter it got better. But actually now I'm using bottled water.
A lot of people say that.
I'm using Masafi water to wash my hair now because it just wouldn't stop falling out.
So do you use the bottle itself?
Oh, absolutely. I have bottles in my shower, and I will just shampoo and then use the bottles.
Oh, that's so much effort.
Believe me, it's a huge effort, but
It's worth it.
I mean, it's important because despite using all the serums and everything, like I said, the water was the biggest factor. So I was like, okay, Masafi water. Now I have it like piled in my shower so that it's easy. I can just do it. Really, it's that bad.
Okay. Yeah, I mean, I noticed the hair thing as well, especially when I moved here. And I know a lot of people complain. At first, I refused to believe it.
Okay.
I was like, no, because I adjusted to the UK hard water as well. And I was like, it should be fine. But then I noticed immediately. But talking about Dubai, the other thing here is a lot of people also invest a lot in procedures to their face, right? And we hear the word Botox thrown around a lot. So where do you stand on Botox?
I love Botox. I love Botox. I love to feel good. I want people to feel good because when you feel good, this is how you live and fulfill the most potential in your life. Your mental health, physical health, everything. I think these things are important. So I don't think it's really about the Botox. It's about how people feel and do what makes you feel good. This is my philosophy. Do I believe in changing people's features and their faces to look abnormal or alien-like? Absolutely not. I see too much of that. But I'm all about subtle enhancements to make you feel good.
I like that because my next question for you was actually going to be, I feel like a lot of self-esteem issues also stem from your skin, especially as teenagers. Some people struggle with acne and then that becomes a thing. But I'm glad that you covered that, whatever you need to do to look your best, to feel your best is super important. But you also touched upon how Botox can be done really badly. And you see so much of it here. So how do we know where to go, what to do?
So what I see is Botox done badly, but fillers, especially fillers in Dubai, done badly. And this is one of the first, it was a culture shock when I first got here and I saw all of this, it's almost dehumanization with fillers. With the super filled cheeks and the jaws and the really super pointy chins and the big Russian lips. And it's like a copy and paste. So everyone in Dubai looks the same. But, I want to kind of change the narrative a little bit. And this is why I do a very natural enhancement. In terms of how to find the right doctor for you, the right person to do your treatments, social media is very powerful. I have my whole portfolio on social media. So people know exactly what I'm doing, how I'm doing things. I'm talking a lot, I'm communicating. And I think communication is a big thing because you need to find someone who aligns with your ethos and your morals, your values. And you really understand that about someone through what they say, how they come across, And this is why I love the reels, because people get you, they
Mm.
understand you. And I'm all about building, I like to say this, like I'm building a garden, and I'm just focused on building this beautiful garden where the butterflies will fly into, and the butterflies will find it. You know, even the rarest butterflies will find that garden. But if you're chasing the butterflies, then they fly away. So my focus is I build my beautiful garden, and those people that, you know, my work resonates with them, those people will come to me. They will find me.
Wow, that's a very good philosophy to apply to any part of life, right?
Yes.
But yeah, you're right. I think, and I love how educational your reels are as well, because
Thank
I
you.
think a lot of the times we don't really know. Like you just hear, oh, wear retinol if you're above this age, and people don't even know what is retinol, what are the different ingredients in it. But yeah, no, good job on the education part. But again, you know, when you said everybody looks the same,
Uh-huh.
I think that also stems from the fact that now people perceive this as the new standard of beauty. And that's why everyone wants to look that way. And, you know, it's crazy because I also teach at university now. And my students are super young, what, 20? Less than that?
Yeah.
And they already look like that. And I was like, so it's starting so young, because all of these procedures are meant to come in to like support maintaining your youth. And okay, yes, making you look, but at that age, it means that you're already, and it ages you. They look so much older.
Get it.
So then how do you approach this whole thing of like telling, not even telling, but like changing that narrative of, you know, beauty is natural?
It's a perception shift that we're seeing in society, and I don't agree with it. And, you know, I'm very clear with my patients. If something's just going to look abnormal, I'm not doing it. Something's not going to look good for you or suit your face, your features, I'm not doing it. So you'll have to find another doctor. And the reason why there's this perception drift, and the reason why everyone is ending up looking so overfilled and everything, is because I think the doctors and the medical professionals in this industry, they're maybe looking at the figures in the bank account a bit too much. So they'll do things that people don't need. And I think there's a greed. So this is a real issue, the greed. Whereas, you know, I'm happy to say no, it doesn't matter. What I put the patient first, I will say no. And we're in a place of influence, a place of trust. You know, if a doctor with so much experience and credentials is telling you something, you're going to listen to it. So it's our responsibility to say no. And I don't think enough doctors are saying no. But, you know, I'm UK trained. I'm American board certified also. And I think there is a difference in culture between, you know, the way I was trained and, you know, everything in the NHS. It's not private healthcare, right? Working for the government. The NHS is so I have a lot of morals and values from that. Whereas in a lot of these other countries, privatized healthcare, where the doctors will say, yes, you need this test, even if you don't need it. And then that comes across into aesthetics, and they'll say, yeah, you can have this, even if you don't need it, because it's building the bank account. That's the harsh truth.
I agree. You know, even here, I remember one time I went to the dentist and I was like, let me just get like a cleaning. And she told me I needed 9 fillings. I was like, there's no way. I take care of my teeth. So I went back home and I went to the dentist, and the dentist was like, your teeth are perfect. So was she just going to drill holes in my mouth?
God. Oh my God. This is shocking. Not even 1 or 2.
No, 9. And
fillings?
she showed me as well which teeth they were going to be.
Oh my God.
And I was like, oh, was she just going to drill holes in my mouth? And I hear this story repeated many times. I had a friend who went to the hospital because he had a cold, and he was prescribed like really expensive medication.
Yes.
And the doctor said, just bear in mind, you might be infertile for the next 2 years if you take that. He was like, I have a cold. Why do I have infertility now?
This is shocking. I can't even laugh at this. This is very upsetting.
It's scary. It's so scary.
Oh, this was in Dubai? So this is the problem.
People push Because I guess they have numbers that they need to make as well.
Yeah, yeah.
The other thing, you're also South Asian, right?
Yes.
Originally, yeah. So in the South Asian culture, there is a big obsession with skin whitening.
Mm-hmm.
What do you have to say about that?
I think we live in a society where, I don't think, I know, we live in a society where people are really doing whatever they want to themselves, to their own body. Whether it's fillers or Botox, whether it's tanning, they want to be darker. And I think, skin lightening and skin whitening comes into that bracket of people doing procedures and treatments to their skin. I understand that many people, there's this whole, the history from where this comes from, that the whites are superior.
Mm-hmm.
I'm Iranian Pakistani, so I have essentially Indian roots, right? And in India we were oppressed and we had colonized, and we had a lot of bad things done to us by the whites.
Mm-hmm.
And that's just the fact of it. This is not, I hope I don't
It's
sound like
history.
I don't want to sound like I'm racist, but the reality is the whites came in and they took everything from us and they controlled us and they really abused us and they put themselves in position of power. So, historically, this whole, it comes from white people being better than darker skinned people, right?
Mm-hmm.
And also with the African slavery and all of that as well. Historically, it's like, this is what we've learned from the history books, that the white were in power and the people of color were below.
Mm-hmm.
So when people talk about skin whitening, then there's just this immediate connotation that, oh, this person wants to have whiter skin because they think that looking white equals better or something. But in reality, if you think about society right now, people just want to feel good and look good. And when you're South Asian, you have a higher susceptibility of hyperpigmentation,
Mm-hmm.
darkening from the sun, because we have melanin in our skin more than Caucasian. So that melanin can go berserk when you're out in the sun and cause hyperpigmentation and issues. So my patients come in and they're like, doctor, I want to get rid of this hyperpigmentation. I've tanned badly in the sun. What can I do? So there's tons of skin lightening products and ingredients that we can use safely to get them to a good place. Can we take someone who is naturally darker skin toned to a white color? No, that's not possible. And I don't really know how Michael Jackson did it.
I was just about to say.
But I believe he had vitiligo, which is a skin condition that, he had started off with patches of white and then your whole body eventually turns white because you lose the melanin. So it's a skin condition. But yeah, I think the connotation comes from that history. But I think looking at it now in society, and my patients don't think about that. They think about, okay, what's wrong with my skin? How can we fix it? Can I just look brighter? And when you talk about brighter, yeah, you're talking about lighter, actually. That's what it is. So that's what we help people achieve.
Yeah, I think that's the thing, right? To some extent, we all have that internalized colonialism inside of us.
Yeah, because we still come from South Asian households where,
You've heard it
we hear it.
all the time. Don't go in the sun, you're going to get dark.
We hear it.
Right? We all heard it growing up. And even me, my sister and I are very different tones. She's not a lot, but she's darker than me, visibly darker than me. And I would always hear what people would say about her, being like, oh, don't go in the sun. This is not good for you. You're already dark. You already absorb that growing up. And it's like generational trauma that carries on. And that's why then there's always that thing of like, well, I'm getting darker. That's not good. We never see it. Oh, I have a nice tan.
Or you watch the movies where, the Indian Bollywood movies where there'll be the, potential in-laws that come in and they'll say, no, she's a bit dark for us. We don't want her.
Yep.
But I'll tell you something, Sheen. I've had the reverse. People have said to me, oh, you think you're so fair. You think you're so beautiful because you're so fair. You think you're like this because, And, so actually the reverse I have seen like that. You know, people treating me differently because they in their mind they'll put me on a pedestal because
Again,
of
it's still the root
pretty
is the same.
because of pretty privilege, or you know, this history of white skin is supposedly better or more attractive. They'll put me on a pedestal, and then they'll try to knock me down the
They
pedestal.
resent you for it.
They
Yeah.
resent me.
Yeah.
At the end of the day, God creates everyone. We don't choose our skin tone, whether you're darker or lighter toned. Do you? Do you? We're living in a society where people want to be purple or a cat or a dog, and they are.
Or furniture, apparently, now.
Furniture? Really?
Have you not
what?
seen that?
No.
There's a new one, which is they want to be chairs. And they're a chair for like 6 hours of the day, so they don't move. You can sit on them.
Oh my God, I want to be a sofa or a bed.
No, you don't.
I'd lie on the bed all day and watch Netflix.
No, people will lie on you if you're the best.
God, dear.
Yeah.
Oh my God, I
know.
cannot deal with that.
I know. So, yeah, you're right. I mean, everyone can be whatever they want.
If people want to use a bit of hydroquinone, let them. Because there are people out there who are actually trying to be cats and dogs and donkeys and chairs and beds.
Yeah, it's not that bad. And again, it's choice, right? As long as
Yeah.
everyone understands where the choice. And again, it comes back to if that makes them feel better about themselves. So it's okay as long as they're not causing harm. It's fine.
It's their body.
It's their
face.
body. Yeah, let them do it. But what do you think is the biggest myth about skincare that you love debunking?
Korean skincare is a scam. I know I said it. So many people will be upset by this. But Korean skincare is absolutely not worth the hype that it is. And the number one reason, if you're using a Korean sunscreen, be very careful. Because a few years ago, there was a big lawsuit that a big Korean company was advertising their sunscreen as factor 50. And it was actually factor 15. So the implications of this are sunburn, aging, all of these hyperpigmentation, everything. And so when people ask me, I'm like, never use the Korean sunscreen, because in Korea, regulations are not so tight. So skincare brands and, products can make lots of claims, not compared to England or America or even Dubai. But this is the thing. So they're making all these claims, and this is why a lot of Korean skincare, if you order it, has to come from Korea, because it cannot be registered in most countries because the claims are completely false. And if you do the research and development, you do the testing of things, like some countries do the testing for registration, they wouldn't pass.
That's crazy. But would you say that the ones that are sold here, they're not safer to use?
I'd say they're safer because they're registered. And here you have to be registered with the, the municipality or the MOH, Ministry of Health. So they're registered, and so they are safer. But generally going out or going to Korea or, anything.
Yeah.
No regulations. So really, what are you using on your skin?
Oh my God.
There's a big hype. Oh, yeah.
I was trying out the sunscreen.
Oh, really? Which one?
The Juician one?
Beauty of
Yeah.
Joseon. I've heard good things.
Okay.
However, unless someone shows me on a piece of paper with the research, this is factor 50 and not 15, I am very skeptical now, because sunscreens, if you're only going to use one product for the rest of your life, it should be sunscreen, number one. So when it comes to sunscreen, be careful. I'd say always use European.
Do you have any recommendation for which sunscreen to use?
I'm actually launching my own very soon.
Oh.
Yeah.
Okay.
So, I mean, my own. Yeah.
When can we expect that to drop?
End of January.
Okay.
In Dubai, around the world, in the UK, everywhere. Yeah.
Amazing. So
Yeah.
we'll look for that.
And it works. It's factor 50.
It's factor
When we
50.
say it's factor 50, it is. It's French. The
Oh, wow.
French make the best sunscreens.
Okay.
Even in America, the FDA is very strict, right? So the FDA haven't approved any new ingredients for sunscreen since the 1990s. So the technology is very, very far behind. So this is why I always say, you want a sunscreen, European, French are the best.
Okay. Oh my God. So the thing is, I was thinking about asking about the Korean skincare because it's everywhere. And it's crazy how people keep like claiming all sorts of things. And I never believe it when it's so hyped up.
Do they have affiliate links?
Yeah, of
Then
course.
they're going to hype it up.
Of course. They all do. They all have big boxes that they are unboxing and everything. And then
if you have an affiliate link to something, then whether it works or not is questionable. And I work with brands. I work with Color Science, L'Oreal. I work with brands. But I will not promote a single thing I don't believe in. And there's been Korean brands that come to me, and I just, I'm like, I don't want to work with you. I'm sorry. Or if the science is not sciencing,
yeah.
I'm a big science nerd. If it's not sciencing, I'm like, I can't work with you. I'm sorry.
That's so good to know. Okay. Any other myths? Now that you've thrown my whole world around.
Oh my God, I'm sorry. No, I can see the shift in energy.
You know
like,
why?
oh my God.
You know why? Because I was like, oh, I keep looking for a sunscreen. I was like, everyone's talking about it. Let me try it. And I bought it literally like maybe a month ago, and I've been wearing it every day religiously. And then and I was like, what? The one thing I tried.
I'm sorry. I'll send you mine. Okay,
Please.
I'll send you mine.
Okay, another one. Also, what about like how often are we meant to apply our sunscreen? Is that true that every 2 hours or something you need to wear it?
Look, every 2 hours isn't realistic. Otherwise, we should just turn into a sunscreen. You know what I
Just
mean?
bathe in it.
We should just call ourselves a sunscreen and just, refer to ourselves as sunscreen. But no, it's not realistic. So I would say reapply as often as you can. And whenever you're out in the sun, you need to reapply. So if you're at the beach, you're walking around town, reapply if you can. Again, be realistic. So, for example, if you have makeup on and you can't apply sunscreen on top, first of all, you can get the spray-on sunscreen. Still, that sometimes ruins the texture of your makeup. So if you can't do it, it's okay.
Okay.
As long as you just do it once in the morning, it's all right. Don't upset yourself. There's bigger things in life than reapplying sunscreen.
No, you're so right. But, a lot of times people use the excuse of being too busy to do their skincare routine. So what would you say are like the absolute necessities? You said sunscreen, but what else?
So skincare non-negotiables would be number 1, sunscreen. Number 2, a retinoid. Number 3, you need a cleanser, and usually it should be a cleansing balm, because this whole thing about gel and water-based cleansers is insanity to me. You need something which is oil-based, but not a cleansing oil, because they can break people out. A cleansing balm is best because it mixes with the oil on your face, on your skin, and with the makeup, so it can better remove and clean out the pores better. Because the water in the gel cleansers and things doesn't mix well with makeup and grease, so you need a cleansing balm. So I think that's 3 things, and a vitamin C. I would say those are non-negotiables. I don't believe in 10-step skincare routines. Don't do that. Don't have the time for it. Never want to do that. Don't recommend any of my patients to do that. Again, it's just a way of selling lots of products to people and making lots of money, which so many people have managed to do.
And a lot of influencers who will just make money from doing all their skincare steps and buying everything in bulk, and then you're all out there buying, and just it's become a business.
I really think there needs to be some regulation on what influencers are allowed to recommend, advise, because too many people are harming their skin, doing crazy trends, using lots of crazy home remedies. Yeah, I think there needs to be some regulation, because at the end of the day, I wouldn't go to a car mechanic if I had a heart problem. I don't expect people to go to an lifestyle influencer for problematic skin.
But now the other trend I'm seeing is they also recommend all of these collagen and all of these supplements for your skin, and they're all influencers who are like, oh, you can use my code for 10% off.
Yeah.
I'm like, what do you know about collagen?
Yeah. I don't know what to say. The thing is, number one, which type of collagen? There's many types. So type 1 and type 3 are for anti-aging skin, hair, nails. Then you want to have it hydrolyzed. You want to have the highest bioavailability. You want it maybe mixed with other things, maybe some peptides or something, because peptides are the precursors to collagen anyway. So these things boost, the bioavailability and the efficacy of it. So yeah, I see all that, and I think, I have no words. I have no words for most of it, but I'm glad that I have a platform where I can really educate people and people appreciate it.
100%.
This is why my brand is called The Doctor's Dose, because I remember when I first started and people were like, but there's so many skincare brands, there's so many, things out there. Why you? Why are you special? Or why do you want to do that? And I said, well, you know what? There's so many damn skincare brands in the world that there's so much confusion and people don't know what to trust and what not to trust. So in the world of tons of skincare, people are getting more skin problems, harming their skin even more. That's where the doctor's dose comes in.
You're so right. I feel like there's a barrage of information. So, for example, for me, when I decided, okay, maybe I should start using retinol of some sort, and I didn't know, I went online and I was like, first of all, I realized that there's retinoid and there's retinol, and I was like, I don't know what they mean. But what's your advice on that, on like the pre-aging retinol thing?
So, well, everyone, as soon as you're born, you start aging. That's the reality. But when you're about 21, you're going to see the biggest decrease in collagen per year. So it's around 1% per year you lose. So when you talk about anti-aging, really, you should start from around 21 years old, which some people will think, oh my God, 21? This is absurd. No, 21 is when we know per year you're going to lose quite a bit of collagen. So I would recommend a retinoid, like you said. And retinoid is like the umbrella term for retinol, retinal, and retinoic acid.
Okay.
So if you're a chemistry buff, you know that these are different,
Molecules?
Yeah, molecules of like the same kind of thing. But if you retinol and retinoic acid, you have a retinol here, you have retinoic acid here. It's about 1,000 times more effective.
Oh.
And it's very powerful. It's known as liquid gold in our industry. And a really good example of how you know this is so good is Cher has been using tretinoin since the 1960s. So if that doesn't tell you how good a retinoic acid like tretinoin is, then I don't know what will tell you how good it is.
So, again, you threw in another term there.
Tretinoin.
So that's also another one.
Tretinoin is the retinoic acid. It's the name of the retinoic acid.
Okay.
Retinoid is the umbrella term. You have retinols, retinals, like adapalene. Have you heard of that? Then you have your retinoic acid.
Okay.
And Cher has been using it since the 1960s. And that's my greatest example of telling people, if you want to know how good tretinoin is, then, look at Cher.
Oh, wow. Okay. But talking about celebrities, recently on my Instagram, it keeps coming up how, Lindsay Lohan looks so different now and how there's like a new doctor in town in Hollywood.
Yeah.
But it is possible to reverse these like terrible fillers.
100%.
Oh, it is.
You can reverse fillers. You can reverse bad aesthetics on your face and go for a good job. Absolutely.
Oh, you can.
Yeah, but I don't believe Lindsay Lohan has had a facelift.
You don't think so? What do you think she did then differently? Because she looks very different.
She looks very different. But she is only a couple of years older than me.
I cannot believe that she's that young when I realized. But she started work on her face from a very young age.
Yeah. But she's only a couple of years older than me. So in reality, given her age, there's many fantastic medical devices that you can use to lift your skin, to lift your face, and to give you a very nice look like she has. I think it's a combination of, we know she loves Morpheus 8. This is radio frequency micro needling, right?
Mm-hmm.
So, which is the microfine needles going into the skin, but these needles, they transmit energy into the skin so they can tighten and lift. So because she's so young, devices like that can help. And she has, she's documented her Morpheus 8 journey. She says to people she loves that. So things like that, chemical peels, a bit of filler and Botox in the right place, and regenerative medicine. She's had all the collagen biostimulators in the skin, which lift, and they give you a beautiful young appearance without the fine lines and wrinkles, so you're smooth as well. And so I don't believe she's had a facelift. No, don't believe it.
It must be so interesting when you look at people's faces, you can tell what they've done, even like what kind of care they take of their skin, right?
Yeah. And I think Lindsay Lohan is laughing in her bed when she sees that all these doctors and people have this opinion that she's had a facelift. She hasn't had a facelift.
Oh my goodness. Okay, that's good to know. And in terms of for Dr. Hasia, what's next?
What's next? I'm still at the beginning of my journey. I'm on year 1 of Dubai.
Yeah.
I've been a doctor for 10 years in England. And so it took me 10 years to be at that space where I was in England. So now I'm here, I'm in year 1. And I have a long, long way to go, long journey. But when I do things, I want to really be the best at doing that. So whether that's skin or aesthetics, I really just want to be the best. And the way that you're the best is by providing the best service, and just staying true and authentic to yourself and to your craft. That's what I want to do.
And how are you enjoying being online?
Oh, I hated it. And initially I was like, I can't do this. I actually cried the first time I did my podcast.
Why?
And it was just me with a camera, and I cried.
Why?
Because
What did you find the hardest?
Because like I touched on, I'm a Scorpio, so I'm an introverted extrovert. So as much as I'm an extrovert, I'm very introvert, and so I came here with not so much of a following, and then realized, okay, to do well here, you have to have a following because Dubai is all about social media, and then it was my first step on this journey, and I thought, wow, I have a mountain to climb. How will I do this? And I just remember I sat there with the camera in front of me and I cried, and I thought, you know what? Allah help me. I just hope this works.
And it did.
Alhamdulillah. Yeah. It worked in the way that, yes, like people know me, and I have a platform here. I'm so grateful to God.
Do you enjoy it now?
Yeah, no, I enjoy it. But just starting off, I was just like, there's this huge mountain to climb, and I just don't know how I'm going to do it. I came here with 2 suitcases, and I didn't know a single soul. Yeah, I didn't have any friends in Dubai. I didn't know people. So to come here and then to start all this, and I thought, will it happen? Won't it happen? You have this, self-doubt, and I had a lot of that. So then, I paid for an hour session. By the time I stopped crying, I had like 10 minutes left on the camera thing, and I was like finally trying my best, and he was like, okay, you're done. It's like, okay, I'm sorry, bye. I have to just do that all over again now.
Wow, but no one can tell, and I think that that's
you.
really good to hear about the backstory, because I think a lot of times people are not brave enough to start, and they think that it's easy for everyone else who are doing it, but it's so not easy. I think there's so much hard work behind, and people only see the final product, and it's good to hear that you had the same experience.
Yeah.
But no, go ahead.
No, like you said, people see the finished product of that clip or this thing. Absolutely don't see the hard work and the blood and the sweat and the tears that go into it. And I say blood because for women, this is very applicable. We have a menstrual cycle. So the blood and the sweat and the tears that goes into
They're all real.
It's all real when women put that hard work in. So, and especially any woman that does this, I commend her, because the menstrual cycle, really, come on, like for 1 week we're premenstrual, for 1 week we're on a period. We only have 2 good weeks in a month
If you're
to
lucky.
work. If you're lucky. We have 2 good weeks in a month if you're lucky. We have
Yeah.
6 months of a year to work. Compared to men have 12 months. We have 6 months where our brain is functioning.
And also you look differently at different stages of your menstrual cycle. And you're like, well, suddenly this definitely doesn't look normal.
Yeah, I don't want anyone to see me on my luteal phase. The niqab is out.
Oh my goodness. Okay, well, this has been lovely.
Thank
Do
you.
you have any parting message for the audience?
I would say just focus on feeling good. Focus on feeling good, feeling confident. And, that's the main thing. A good mental well-being, and always go to a doctor who actually takes that into consideration and provides more of a holistic approach. It's not just about your external beauty. It's about your inner self.
I love that. Thank you so much, Hasia. This has been incredible.
Thank you for having me.
And we'll keep learning about skincare from you online.
Yes, inshallah.
Thank you.
Thank you.